Here is tip number 2 for adults exercising with scoliosis. Address the sagittal plane first. Tip number 1 was know your scoliosis curve pattern. This woman has a lumbar primary scoliosis curve pattern with a collapse and compression on the right concave side of her curve. But she also has a sagittal alignment challenge with a rounded back or kyphotic posture, creating a collapse and compression in front between the ribs and the pelvis. So before she can expand her right concave side, she must first find a more balanced posture in the sagittal plane to create axial elongation. A sagittally balanced spine is depicted here in the center, where C7 is positioned directly over the sacral base. On the left is a representation of positive sagittal balance, where C7 is in front of the sacral base. This is often due to a round back or kyphosis. On the right is a negative sagittal spinal balance, where C7 is behind the sacral base. We often see this in someone with a sway back posture. Here we can see a positive sagittal balance, but using a compensatory mechanism, flexing the knees, posteriorly tilting the pelvis, and shifting the pelvis forward. Compensatory strategies are often the result of trying to stabilize hypermobile segments in a degenerative lumbar spine. Straightening the knees and bringing the pelvis back to a level position creates a better pelvic alignment, but does not change the round back posture with compression in front between the ribs and pelvis, and perhaps now even the cervical spine. This may signify a structurally stiff spine due to osteoporosis or Scheuermann's kyphosis. Trying to straighten the spine or even reaching the arms overhead reproduces that compensation and shortening of the myofascia in the anterior trunk. Gentle, progressive overhead movements from a stable pelvis and thoracic cage help create an extension moment on the thoracic spine and produce some dynamic myofascial lengthening in the anterior chest wall, as long as the spine remains stable at those more hypermobile areas of the lumbar spine. In a sagittally balanced spine, there is a lumbar lordosis, and the pelvis is slightly anteriorly tilted. This supports the normal curvature of the spine and establishes stability. A more conservative approach to restoring lumbar lordosis is required if there are degenerative changes. From foot to head, a centered pelvis and lumbar lordosis help reduce the three-dimensional impact of scoliosis. Maintaining this during movements like squatting and lifting is a challenge. Techniques to encourage spinal alignment and lumbar lordosis may include imagining a stick on your back against the head, mid-back, and pelvis. Self-cues such as feel the pelvis against the stick or deepen the hip creases may be helpful to maintain a balanced spine and axial elongation. Sagittal spinal balance creates axial elongation and is the first part of the three-dimensional expansion required for exercising when you have scoliosis. Stay tuned for tip number 3. Thank you.